Cairo wakes to the sound of sirens and sunlight cutting through the morning haze. Inside the city's World Health Organization headquarters, the world's attention turns once again to Gaza, a place where hope and ruin now share the same skyline. Ministers of health from across the Middle East have gathered in Egypt's capital, but the empty Palestinian seat at the front of the hall says more than any speech could. It is the silence of a nation's medical collapse, the absence of an entire health system that once served millions. At the center of the session stands Dr. Hanan Balkhy, the World Health Organization's regional director for the Eastern Mediterranean. Calm, composed, and visibly burdened, she addresses the delegates with words that echo through the marble-walled chamber. She says, "You were talking about billions of dollars, and we're talking about decades of work to restore the destruction that has happened in Gaza." Her tone is not political, it is practical, almost weary. Behind every number lies a hospital in ruins, a doctor displaced, a patient waiting for a surgery that may never come. She explains that the question now is not just how much can be rebuilt, but what can even be saved. The question, she says, is how many hospitals are available for rehabilitation versus rebuilding all over again. The line lands heavily. For the international community, it means that Gaza's health system is not only broken, it is starting from zero. In her assessment, the challenge is both financial and generational. Billions of dollars, yes, but also decades of expertise lost, files destroyed, medical graduates gone abroad, entire supply chains severed. Every clinic that once provided vaccines, prenatal care, or dialysis has been replaced by tents, makeshift wards, and battery-powered ventilators. The Gaza Strip, just 40 kilometers long, has become one of the world's most compressed humanitarian crises. Dr. Balkhy shifts her tone to patients, not policies. She recalls how, before the 2023 war, thousands of Gazans were able to seek treatment in Jerusalem and the West Bank. Those medical corridors once linked Gaza's hospitals to advanced care facilities. Today, they are mostly closed. She says, "We are hoping that there will be further opening into the patients accessing the West Bank and Jerusalem, so that they can get the care that is available right close by, the place where they used to go for care before the 7th of October, 2023. It is a statement wrapped in diplomacy, but rooted in desperation. Behind every patient she mentions are families trying to navigate a maze of checkpoints, permits, and power cuts. A single referral to a West Bank hospital can take weeks, time no cancer patient, no child on life support can afford." The director then lays out the basics of survival. "We need more fuel to go into Gaza," she says. "We need more food, more medical equipment, medications, medics, doctors, and so on. It's a huge amount of work, and we're really hoping that peace is fully sustained so that we can start and continue to evolve." In those few words, she condenses what every aid organization has been saying for months. The equation is simple, but the delivery is impossible. Without electricity, incubators go dark. Without diesel, ambulances stop moving. Without peace, none of it matters. Her remarks then turn toward donors, the invisible network of governments and agencies that decide with signatures and spreadsheets how much healing a wounded society can afford. She warns that humanitarian agreements must become flexible. "We need to make sure there's flexibility," she explains, "that if you assess a hospital, it might cost more than expected because the level of damage was not fully assessed." That line exposes a reality that most donors prefer to avoid. Every project in Gaza costs more than predicted because the destruction never ends. A hospital half rebuilt last month may be rubble again today. The difference between rehabilitation and reconstruction is not technical. It is tragic. Dr. Balkhy's next words strike at the heart of the crisis. "There's been very little left of the healthcare system in Gaza," she says quietly. "You have children that were born over the past 2 years, who many of them, I'm assuming, have received 0 doses of immunizations. 0 doses. For a doctor, that number is catastrophic. Immunization programs, once a symbol of progress, have vanished. The result is a generation unprotected from polio, measles, diphtheria, and meningitis, diseases that much of the world has forgotten, but Gaza may soon remember painfully. Her tone darkens further when she lists the outbreaks already underway. The outbreaks of infectious diseases are spiraling out of control, whether meningitis, Guillain-Barré syndrome, diarrheas, respiratory illnesses, she warns. We're talking about a mammoth of a work. It's huge. The amount of work that needs to be done in Gaza is unimaginable to me, and I think we're going to have to take it step by step. The phrase step by step may sound bureaucratic, but here it is survival philosophy. There is no shortcut to restoring a health system flattened by war. Every step, clearing rubble, restoring power, reopening clinics, is a fight against time. Her message widens beyond Gaza. She reminds the ministers that this region, 22 countries, 750 million people, is already carrying multiple burdens. 11 of those countries are under sanctions, she notes. The sanctions have a toll on healthcare provision and the continuity of upgrading and sustaining it at the right level. We also have the largest humanitarian crisis in the world in Sudan, where people have been displaced to at least 5 different member states. The audience listens in silence. Around the room, delegates take notes, some whisper to aides. The numbers she mentions are staggering, but her underlying message is clear. Health is never isolated from politics. Sanctions, conflict, displacement, they are medical conditions by another name. As she finishes, the applause is polite but solemn. For Dr. Balkhy, this is not about applause, it is about accountability. Her words will become part of the official record, but she knows that in Gaza, the record is being written in lives lost, not lines of text. Outside the hall, the conversation continues among reporters and health officials. They speak about logistics, fuel convoys, sterilization units, mobile clinics, but also about morale. WHO teams inside Gaza are working without electricity for days at a time. Doctors are operating by flashlight. Nurses are improvising IV drips from plastic bottles. One WHO field officer described the situation as a continuous triage of the impossible, choosing which patient to save when medicine runs out. Another said, "We are managing a war zone, not a hospital." Those testimonies never make the press releases, but they define the reality that Dr. Balkhy summarized in a single word: unimaginable. The human cost extends beyond hospitals. Public health experts warn that the psychological trauma of repeated bombardments, displacement, and grief will have long-term consequences. Mental health care, once limited but available, has nearly disappeared. Suicide rates are rising quietly, especially among young men who see no future beyond blockades and ruins. Aid groups say that even when supplies reach Gaza, distribution is paralyzed. Warehouses are hit. Fuel shortages cripple refrigeration. Water contamination spreads disease. Every success feels temporary. Every achievement fragile. And yet, amid the exhaustion, there is resilience. Doctors who once fled have returned. Volunteers train teenagers to deliver first aid. Mothers convert homes into neighborhood clinics. It is a kind of grassroots medicine, born not from policy, but from necessity. Dr. Balkhy calls this the human spirit that keeps WHO's work possible. She reminds donors that recovery is not just about infrastructure, but about people, the ones who refuse to give up on their communities. Her closing words in Cairo capture both exhaustion and hope. "We're really hoping that peace is fully sustained," she said earlier, "so that we can start and continue to evolve." It is both a plea and a prayer, a recognition that medicine alone cannot heal what war continues to break. As the conference adjourns, delegates file out, their conversations blending into the hum of Cairo traffic. The Palestinian seat remains empty, but its emptiness speaks louder than any policy brief. In that silence lies the weight of a people's suffering and the burden of global responsibility. The World Health Organization estimates that more than three-quarters of Gaza's hospitals are either destroyed or severely damaged. The few still functioning operate far beyond capacity. Surgeons work 16-hour shifts. Dialysis machines run non-stop. Maternity wards overflow with displaced families seeking shelter. Reconstruction will take years. Restoring public trust may take decades. The challenge is not only to rebuild walls, but to rebuild the idea that healthcare is a right, not a privilege. Dr. Balkhy's voice echoes long after she leaves the stage. The amount of work that needs to be done in Gaza is unimaginable. Those words are now both a warning and a mission statement, a reminder that the healing of Gaza cannot begin with politics alone, but with the simple, stubborn act of care. For the millions waiting behind broken hospital gates, that care begins with fuel trucks at the border, with vaccines crossing checkpoints, with doctors who still show up each morning. It begins with the world remembering that Gaza's health crisis is not a headline. It is a wound still open. As night falls over Cairo, the conference lights dim, but her message remains bright in its clarity. Rebuilding Gaza will test not just the resilience of a people, but the conscience of humanity itself.
حماية الإنسان وضمان استمرارية توفر الدواء الآمن ليهدف إلى تعزيز صحة الإنسان وتسهيل الوصول إلى الخدمات الصحية. معالي وزير الصحة لتعمل على تضمين الجوانب الصحية في السياسات الجانبية بعد استخدام الدواء من قبل المريض. لذلك طبقنا في تتبع الدواء حيث تحمل كل عبوة دواء بارصور، وكذلك يساعد في التنبؤ المبكر للتتبع منذ إطلاق النظام في عام 2019 بقيادة معالي الدكتور تيدروس أدهانوم ولدول الإقليم لبناء أنظمة صحية أكثر مرونة واستدامة، ومن ذلك مبادرات دواء بأسعار مناسبة ودعم الصناعة الدوائية الوطنية. برزت أهمية التعاون بين الدول في تطوير
You were talking about billions of dollars, and we're talking about decades of work to restore the destruction that has happened in Gaza. And I think that assessment, even when we have been talking to donors over the past 2 years, by the way, in rehabilitating the hospitals, the question is how many of them are available for rehabilitation versus rebuilding all over again. Of course, the immediate need today, we are also hoping that there will be further opening into the patients accessing the West Bank and Jerusalem so that they can get the care that is available right close by. And that's the place where they used to go for care before the 7th of October of 2023. So there's a lot of that side as well. We need more fuel to go into Gaza. We need more food, more medical equipment, medications, medics, doctors, and so on. It's a huge amount of work, and we're really hoping that the peace is fully sustained so that we can start and continue to evolve.
How many hospitals?
With an open mind, and we have been speaking to the donors, by the way, because all of these agreements between the donors and the different implementers is based on MOUs. And we need to make sure that there's flexibility, that if you do assess a hospital, it might cost more than what was expected because the level of damage was not fully assessed. And the for themselves, we would say that there's been very little left of the healthcare system in Gaza. You have children that were born over the past 2 years who, many of them, I'm assuming, have received 0 doses of immunizations. You have patients to be treated. The outbreaks of infectious diseases are spiraling out of control, whether meningitis, Guillain-Barré syndrome, diarrheas, respiratory illnesses. We're talking about a mammoth of a work. It's huge. It's huge. The amount of work that needs to be done in Gaza is unimaginable to me, and I think we're going to have to take it step by step and understand Summarize. So this is a region of 750 million people. It's a region of 22 countries, and 11 of those countries are under sanctions. So the sanctions have a toll on the healthcare provision and the continuity of upgrading and sustaining the healthcare provision at the right level. So that's one problem, and we're going to be addressing that. We also have the largest humanitarian crisis in the world in Sudan, where people have been displaced to at least 5 different member states. We also have